Welcome everyone to my October 14th, 2025 webinar entitled Adventures in Energy Healing. Um, what to say about this? Doing energy healing at the end of a long career of healing um, is still an adventure, something I look forward to every time I go to do a consultation. And I think the reason I look forward to it is that I never know what's going to happen in any given session. There's no planning ahead. Um, Clients may have something that they want me to put attention on, which I do, but I take a very broad approach when I start a session and see where my attention goes. And so it's always an adventure. It's always something new, um, often quite exciting, um, and very, very gratifying for me to do. Uh, to help you appreciate why I think think this is so special, I'll review a little bit about my history. um, Long ago, I was counseling hardcore heroin addicts in an outpatient methadone support program in Philadelphia at the old Philadelphia General Hospital, which I believe they've torn down by now. And that was a long time ago. And while I was doing that, I realized that I didn't have the credentials to really do anything to, as a profession that would allow me to really help people and to be able to fulfill a sense of caring for others that I felt very strongly. My father was a physician, actually a psychiatrist, which means he didn't know much medicine, but he did go to medical school and then did a psychiatric residency. But that was back in the days before um, antipsychotic drugs had been invented. So we had very little pharmacology in those days, pharmacy in those days. And so his main job was talking with people and listening to people was his main thing, and offering some guidance and suggestions. And I learned quite a bit from my father, but I I frankly was inspired by the work that he did. And so I was counseling hardcore heroin addicts. Um, it became clear that I needed an advanced degree. I needed a professional degree. And so I went to medical school. How I got into medical school was an adventure of its own, which is for another time. Um, and in your junior year of medical school, you rotate through a number of departments and you learn a whole bunch of stuff. But part of what's going on when you're going through those various departments is seeing where you fit, seeing what you really are attracted to, what looks like it could be a profession for you, uh, perhaps for the rest of your professional life. And I settled on pediatrics. I really enjoyed working with kids. I appreciated that their ability to get well was enormous. And I also appreciated that they didn't suffer from diseases of chronic abuse of the body, smoking, drinking, etc., poor diet, poor lifestyle. And so, kids want to be well, and um, they do the best they can to stay well. Not so much by lifestyle choices because they don't have that much of a choice, but just their bodies are so vital. And it was really fun uh, being a pediatrician. Um, when they were seriously ill, part of that was doing some real diagnostic work because kids generally couldn't tell you what was wrong with them. They could only tell you what hurt. And so, you had to be skillful as a diagnostician, a role that proved valuable later after I had learned Maharishi Ayurveda as an alternative source of healing and found that I could help people by providing lifestyle choices that would be really valuable for them. After good number of years practicing medicine and Maharishi Ayurveda, I was able to get on the Invincible America Assembly, which was a extended course um, for people who practice transcendental meditation in the advanced TM Cities program. And I was on that for about 6 years and 8 months. Spent quite a while on that. And somewhere near the end of that tour of duty as a Siddha, as we called ourselves, a friend of mine had a repetitive stress injury uh, and in the arm. And I heard about it and said, let me see if I can do anything with that. I had no idea what I was supposed to do, absolutely none. But I just ran my hand like this, my fingers up and down the arm. And like I said, I didn't know what I was doing, but they could feel something as I did that. And within a few days, their pain went away. And I thought that's really cool. And so I started studying energy healing. Pranic healing was the first one, and then I got into some other things. And along the way, having discovered that I had some insight and ability in this area, I took training in emotional freedom technique. It's often known as EFT, or people know it as tapping. It's where you tap on various points like that. And there were different systems of that. I learned some things. Um, and I got pretty good at that and could help people with their symptoms. One of the special things about EFT is you start out and you say, even though I have, and it's really terrible, or something to that effect. And um, the point is, you don't try to deny the existence of the problem. It's even though I have that, I can be healthy. And so you flip the thing around, and it works extremely well. Um, so I practiced that along with the little energy work that I knew, which was practically nothing at that point. Um, I learned the option method. Won't go through that now. Ho'oponopono, which is from Hawaii, and that's just four simple phrases that helps to turn around the energy that underlies whatever condition is going on. And that could be, the things that got somebody landed in prison. One of the first studies done on Ho'oponopono was done in a prison. And it was interesting that the master who did that just looked at patients at inmates charts, never met them, and just by reading the chart and then doing the Ho'oponopono, those four phrases, um, people got better, and even recidivism went down. That's people who commit more crimes. Even that went down, so that people didn't wind up back in prison. It was quite an interesting study. So Ho'oponopono was very charming and very appealing. And so it's partly psychological, but it's a lot of it's just the energy of it, particularly with the original study where the practitioner never met the prisoners. Had an opportunity to learn some things about inner relationship focusing, work of Ann Weiser Cornell, which I still use a great deal. Um, and eventually, well, partly along the way, because it stretched over many years, I studied matrix energetics with Richard Bartlett, and I took almost all of his courses twice. I always said I was a slow learner, and I learned just a huge amount about energy healing from him. I'll discuss some of the principles of that in a minute. Um, as I was doing my work over the years, I'm going to say I found certain people when I did interrelationship focusing along with the energy work, that they lapsed into a process that I called symbolic processing, where people would tell me a story about what they experienced. And some people were very imaginative, very creative. Um, the Freudian psychologist would have jumped on it with the analysis of what people said, but in doing symbolic processing, we do that without any interpretation of what comes up. We just let the process itself provide the healing. And of course, the energy work is going on at the same time. And that's quite a lot of fun for me because people do all the work. Well, people generally do all the work anyway. Um, but people are doing this. It's kind of a fantasy thing, and transformation takes place. Their problems disappear, and they disappear right in front of their eyes, so to speak, as they see or hear or feel the transformations take place right at the moment. Um, I think I put in my ebook one of the most striking examples. Somebody had been molested, I think, by their father, if I remember the story correctly. Um, and that had gone on for a period of time. And now they were decades out from that experience, but still suffering from it. And they did a marvelous job of symbolic processing. And eventually they found themselves, pardon me, running from some scary thing that they couldn't quite see. And all I did, the only thing I really did in that session was suggest that they turn around and face the scary thing. And what they saw was a one of those blow up clowns that has sand in the bottom that makes it stay upright. And kids can play with it, wrestle with it, bop it, and bang on it, and all sorts of things, and it will bend over and then it comes back up again. It's really kind of cute. I haven't seen one of those in decades, but they were very popular early on when I was doing my work. Um, no, I guess it was when I was a child. I just remembered that, but they remembered it. So they saw this, and it got bigger and bigger and bigger. But holding that quiet space within as that happened, they were able to just watch it, and then it popped and collapsed, and they were free of this torment that had been inside them. Now, you could analyze the story. It's pretty obvious. You don't have to really do it. But the process itself took care of everything. And when the balloon popped, they were liberated from what was tormenting them inside, which they hadn't really recognized. And they didn't have to think of it again. And it was quite interesting because their personality quite changed. Instead of being meek and timid and afraid to do things, afraid to meet people and to talk in public and stuff like that, they became very confident. It's like all of that fear, everything just went when that balloon popped. It was very, very exciting work. So let me talk a little bit now. I'm going to take a drink of water. Let me talk now a little bit about some of the principles of energy healing, because I think they help give insight into what this is all about and, in a sense, why it's so exciting to me. The first is one has to have consent. One has to obtain consent to go into, as I like to say, that is to look into a person's energy field, to feel into the energy field. And fortunately, a lot of people are willing to give consent. I know only a few people that I've run into who, in a sense, said, I have a problem. And when I tell them what I can do, they go like, no, I don't want to do that. So consent is usually freely given. Uh, Safety is a big factor in energy healing. And the safety in the training I got in matrix energetics was to be an observer. It's not my energy. When a person practices pranic healing or qigong, one uses one's own energy, and that can be draining. And so there's all these techniques about taking energy from the atmosphere, directing it at the client, and so on and so forth. And there is some risk involved, which is acknowledged in the training in those areas. But in matrix energetics, you work as an observer. And I always say I work as a catalyst by my attention, by my coherent attention on a person's situation and the things that I discover things that I see. I am just a quiet observer. Another aspect of that is that I really transcend while I'm doing that. And so anything that comes out of that person just washes past me. It doesn't stick to me. I do occasionally get some experience of sticky energy, but I have simple techniques for wiping that away, getting rid of it, discarding it so that it won't affect me. So safety is a very important thing. I'd been asked about that last month, and I think that reveals some of the sort of specific details about how I do that by being an observer and having ways of getting rid of energy that might tend to cling to me. Um, Another factor is avoiding preconceived and cognitive notions, that is, ideas about what should be, what the problem is, and what it should look like when it's resolved. Um, we avoid specific goals. Um, Clients usually have goals. They want to be pain free. They want to feel comfortable, to be productive and creative, and so on. And we say that's fine. That sets a direction for you. But when I'm working, I just work with what shows up. So another thing that I do then is when I start out is I scan the client's energy field. Some people say read an aura, um, but I just scan the field. Just see what's there, see what draws my attention. And interestingly, sometimes it's inside the body, sometimes it's in the field around the body, and sometimes it's out in the cosmos, even galactic distances. Um, it just whatever shows up. And so part of my training was to look spherically, look at everything all around and what's going on in this patient with this client, what is influencing this client to have this problem that they're concerned about or set of problems. And then one of the fundamental teachings took me a while to actually really be able to augment it, to be able to practice this, and that is to notice what you notice. And I remember Richard Bartlett in Matrix Energetics Instruction saying that over and over again. Notice what you notice. And for somebody like me who tends to be very focused in their attention, to take a very broad view and to notice what shows up, um, took some training, took some practice, and I had to work with a bunch of clients to open my awareness that way, to allow my awareness to be broad and to take in whatever was going on. Now, noticing what one notices, one engages in a practice that Richard Bartlett called tracking. And that means follow the energy pattern where it leads you. So sometimes it'll start out, patients that I've been working on lately, often it's in the heart, which means that there is a emotional component and often a karmic component, a strong karmic component, um, to what's going on. But then one needs to get specific. So then just following where the attention goes. So it's an interesting exercise to watch what shows up visually, auditorily, tactily. Those are the way they usually show up for me. Um, and just see what comes to me. Um, and I've been working with some clients lately who have some very specific problems, and I'll be talking about those in just a minute. Um, but a lot of times my attention doesn't go to the areas that they are concerned about. It'll go somewhere else. It'll go to the head or the heart or the abdomen, pelvis. Um, it may go out, as I said, into the aura around them or into space. Um, and so I just follow that wherever it leads, and then work with whatever shows up. And I'll talk about the work here again in a moment. So doing this, watching, scanning and watching, noticing what I notice and tracking what notice as my attention shifts, it allows that being innocent in that process allows transformation to take place. So sometimes I tell people where my attention is Um, and oftentimes I don't. And then I'll just ask them afterwards, did you notice anything? Um, and some people were very perceptive, and others were saying that was pretty boring. But well, I was really settled during the session. I felt really settled. It was really deep, and I feel better now. And it may be very vague about how they feel better, or it may be quite specific. Pain sometimes disappears practically instantly, at least during a session, but sometimes it doesn't. Sometimes it takes a couple of days. Sometimes it takes several sessions. That depends on the nature of the karma and the degree to which it is physically manifested. That is, things that are wrong with the person. So having all of that really has brought fulfillment of my dharma, my life purpose as a healer. Um, I had recognized healing as my dharma long ago, um, and practicing medicine. I felt a little, no, I felt more than a little frustration that I had a lot of tools, and I knew that if I did my job well, if possible, people would get well. And one of the things I learned along the way of practicing medicine was that I was not God. I didn't make things happen. My job was to take care of people, to do my part as a physician. And nature took care of the rest. I saw people live that never should have, that were seriously ill or injured. And I saw people die that you go like, why? They weren't that bad off, but yet they died. Um, and I realized that there was a big gap in understanding, the lack of understanding of what produces healing. And it all comes out of nature and it all comes out of karma. And my job was to be a catalyst. I use that word a lot. You've heard me say it. My job is to be a catalyst, to use my attention to catalyze, to allow transformation to take place. And it's as if nature needed that that quality of coherent attention, so that the intelligence of the physiology that is in the field can manifest itself physically and emotionally and spiritually. So let me give now some examples of energy healing. Um, and I'll do it in terms of the categories of healing: physical, mental, emotional, and spiritual. So, on the level of physical problems, I've been working for quite a long time with someone who had a very severe hemorrhagic stroke. There are two kinds of strokes, basically. They're occlusive, meaning that blood vessels to an area of the brain are blocked. And then they're hemorrhagic, which means blood vessels within the brain have ruptured, at least one at a time, usually just one at a time, has ruptured, and bleeding has occurred. And that bleeding puts pressure in the brain, basically shuts off circulation to a section or even a large part of the brain. Um, and that produces damage to the brain. So either of those processes, but this particular person had a hemorrhagic stroke, um, and was mostly paralyzed. Speech was affected, cognition was affected. Um, they were in really bad shape. Couldn't get out of bed, couldn't sit up. Um, really, really in bad shape. And I think it was about a month after the stroke, I started working with them, and progress was made. And it was not instantaneous. It was slow going. Um, and I kept working on them 3 times a week, basically. Uh, we shortened the sessions. I usually work in groups of 3, but I divided these sessions in half, so I did 6 sessions as a package, and um, change started happening. Even right from the beginning, things started getting better, but slowly, little increments, baby steps, as people often say. And the work was gratifying. Somewhere after, I think, a couple of months or so, I got feedback that the nurses thought that the progress was quite remarkable. Um, and so I felt really good that we were doing a good job. We were getting things done. We wished it would go faster, but it was quite remarkable. I have worked with other people with strokes, and there was somebody who had encephalitis, which is a viral infection of the brain. Um, that was quite serious. When I was working with that person, they could only say two words at a time, and there'd be a long gap. They were having really hard time finding words, had trouble expressing themselves. And that particular person had trouble remembering nouns, names of things, parts, stuff. Um, it was quite fascinating. And they showed very rapid progress when I started working with them. And I worked with them for quite a while. Progress gradually slowed. Um, the inability to find nouns got better, but was not completely relieved. But they are now, as far as I can tell, quite normal. I can have a conversation with them, and we don't get these pauses as they search for a word. It used to be kind of like playing charades with them, where you had guess what the word was that they were trying to find from the context, and they could offer other phrases to describe what they meant, but they couldn't find the word. It was quite interesting. Anyway, worked with this person with a stroke. They've done much better. We still have a ways to go, and I'm continuing that work. Um, Infections are things that I work with quite a lot, and they're very helpful. Influenza kind of problems, colds, flus, um, but also bodily infections like localized infections like abscesses. Um, I generally can get those to heal very quickly. Um, I am strikingly successful with periodontal abscesses. That's the kind of abscess you get in the root or the base of the root of the tooth. Um, they tend to be very painful when that occurs, and they erode the bone that holds the tooth. Can be seen on X-ray, and dentists will often perform and tell you it's absolutely essential to perform a root canal, which means drilling out the root of the tooth and then filling that back in with. You have to sterilize it and then fill it with a filler. Um, I usually can get rid of periodontal abscesses in just a couple of 3 days. That is, the pain goes away, and then we continue a little, get get them really healed up, and oftentimes the problem they're done. The problem is done. They still have the cavity there where in the bone that you can see on an X-ray, but they don't really have an active infection anymore. I've had quite a bit of success with oral mouth ulcers, um, and I don't know what to say about that. It's just something I work on, and it goes away. Now, when I say work on it with all of these particularly focused things, it's just that my attention will go where it needs to go. It does not always go to the infection site when it's a localized site. It does not always go there first, but I'll eventually get there. But sometimes I have to deal with something that seems to relate to the karma, and it's often in the heart or the abdomen. And the way I work on that is my attention is there, and I will use my hands to move the energy field of the client and kind of loosen it up like I was untangling a ball of yarn or something that was tangled up. And I'll just work the thing and get it to open up and expand it. I'll help to pull it open. I'm not using my energy when I do that. It's just a feeling thing. And when we do the group clearing session later on in this session, I'll do some of that work with you. Um, okay, I've worked with people who've had surgeries and fractures. Um, I can generally accelerate the healing of a fracture to literally days, which is quite impressive. I think. I think it's impressive. Uh, my clients do not always believe that they are better, um, and they may still feel a little pain, but I can tell that the fracture is settled down, and I can help heal up surgical wounds, and often remarkably quickly. So that's some of the physical problems that I work on and have a lot of fun doing. Mental, emotional stuff, anxiety, depression, things like autism, um, can be quite debilitating for people. I have a group of clients that contact me every once in a while because they're going through something and they have a lot of anxiety or depression. Um, and there are people who are worrying all the time. They're having trouble sleeping, um, and so on. And usually, people, particularly have been my regular clients, either one or sometimes three sessions. Uh, pardon me. We'll get them cleared up, get them settled down. It's their problem usually isn't completely gone, but it gets them settled down so they can function. And that those are karmic things, often familial patterns are there, and we just keep working to alleviate those patterns. Um, Sometimes I have to go back generations or go back lifetimes to find a source of the anxiety or depression that people may have, um, and then help them get it straightened out. Um, the way I do that again is with attention and coherent attention. I just basically transcend and bring them into the field, the transcendental field with me, so that their awareness shifts from worrying about stuff to just being in bliss consciousness. And usually just the re experience of that. And they can take a breath and everything feels much better. So I love doing that kind of work because, um, particularly for those clients that have that kind of lifelong anxiety or depression, because it can pick them up very quickly, settle them down, get them functioning again from the basis of bliss consciousness. It's all about the self. And it's why I call my practice Partnership for Well-Being. Where is it there? It comes up backwards on my screen. Um, the being. It's about being, uh, being oneself, just being oneself. And then there's spiritual problems, self-doubt, self-loathing, purposelessness, hopelessness. These are altogether common. And almost everybody who has mental issues has some self-doubt or self-loathing. They're disconnected from the self. And so my work helps to reconnect them, helps them feel settled, and self-referral, as we say, rather than being object referral, which means, being their behavior or their thinking, their feeling level being controlled by what's going on in their life, or their own internal process. It helps them to get settled down, find their self again, and to feel hope and to feel purpose in their life, to know what, to be aware of what nature wants them to do. So those are the physical, mental, and spiritual kinds of problems. Contact with the self is essential in that it's essential in the work that I do. And my being in that transcendental field with them, with my clients, allows that transformation to take place and in an effortless and painless way, because they just experience bliss. And I think all of you who are on the call on the webinar tonight, I think you've all worked with me and have had that experience. You know exactly what I'm talking about as the recipients of that experience. So with that, I'll draw this presentation to a close. If anybody has any questions or comments, please put them in the chat and I will relay them to the group. Only I will see what's in the chat, I do believe. Um, call up the chat. Here we go. So while you're composing any comments or questions, I'll give you just a minute or two here. Um, my next webinar is scheduled for the second Tuesday of November, which is the 11th of November, happens to be Veterans Day. Canada has its own day too, and I can't remember what it is. I'm sorry. So that'll be the date if we do a webinar in November. But at the moment, I am without a topic. I have done so many of these things. As I said, I think, what did I say, 118? 119? What is it? I'm going to look again because I'm impressed. 100. This is the 119th webinar. So I've quite run out of topics. So I'll look forward to your giving me suggestions. And appreciate it very much. And I will let you know, hopefully more than 2 days in advance of the 11th, what the topic will be. I'll try to get invitations out beforehand, but it will depend on when I come up with a topic. Otherwise, you're going to get an email that says, I don't have a topic for this month, and we'll see you next month if we can come up with one. I got a comment or a question. Is it necessary for your depressed patients, clients, I prefer to call them, try to avoid the medical terminology, although even I slip. Is it necessary for your depressed clients to do transcendental meditation program? Well, it sure helps because it gives them contact with being, with the self. It makes them self-referral, and it helps to get out of that cycle of negative feeling and experience some bliss, experience some hope, and experience some sense of purpose in life. Um, and so it's really a great thing to start transcendental meditation if you haven't learned it, or to renew your commitment to twice daily practice. Twice daily practice is really important. Once a day is good, but twice a day is the prescribed dosage, to use a medical term, and it really helps. Um, and as I said, it's exactly for the reason that it helps people to experience a field of being, a field of thought where they're happy, where they're blissful, and where they have that sense of knowing what they should be doing. So it's a great thing. So thank you for the question. Not seeing any other questions, then I will conclude the presentation portion of this webinar and turn off the recording, and then we will begin the group clearing session where we'll actually um, transcend and experience some of that bliss consciousness that clears all discomfort and allows physical healing to take place.